Many research studies support the idea that for achieving the best results, regardless of the type of massage you perform, whether it is full-body stress management massage,
it will be area number 1, and we will perform Petrissage number 1. 3-4 time on each position, and area number 2, Petrissage number 1.
sports massage.
We have to warm up to bring muscles to normal tonus, and
orthopedic massage or massage for treatment of asthma.
yeah, like this, not staying on one place and massaging in order to inhibit the sympathetic nervous system opposite.
At least 50 to 60% of the procedure time must be spent on kneading. Medical massage recognizes 12 kneading techniques. 5 or 6 of them are used in daily practice.
Fingers moving to the thumbs, and thumbs play role of barriers, and in this case, as you can see, we perform mobilization of fascia, muscles.
However, each massage therapist should know and perfectly administer each of these techniques. Unless otherwise stated, at least 3 to 5 movements of each kneading technique should be performed in one place, before moving to a different area. We hope that you will enjoy your lesson. Thank you. Petrissage number 1.
You have to use thumb as a barrier. You see my fingers here. I'm applying initial pressure, and after this I'm moving and shifting. This is barrier. Do not allow it, you see, to run away to this tissue. I'm shifting, 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 shifting. And my recommendation to stay 3-4 times. This is, for example, position 1, 2, 3, 4, and 1. You see, in deeper and deeper, to stimulate deeper, to shift deeper and deeper, deeper and deeper stimulation. Under my hands, due to this deformation, I create massive electrical activities that will awake reflexes. This is Petrissage number 1. We'll demonstrate Petrissage number 1. On calves, you see initial pressure, thumbs barrier, posterior tie, see Petrissage number 1. Just to refresh, Petrissage number 1.
Petrissage number 2.
Petrissage number 2, the same manner, but hand after hand. You see, again, applying initial pressure, and we're performing hand after hand. Petrissage number 1 and 2, we're utilizing actually almost on all parts, except neck. Sometime on neck, in cases of fibromyalgia, we do utilizing the neck Petrissage number 2, but on calf muscles, posterior tie, anterior tie, we do utilize on arms Petrissage number 2, and again Petrissage number 1 and Petrissage number 2. Number 2, you see, wow, much more massive. I can shift a lot of tissue and to stimulate much deeper layers. As well on Petrissage number 2. Petrissage number 2, hand after hand, we perform shifting, 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 shifting.
Petrissage number 3.
Petrissage number 3, thumbs will not move like at the time of performances on Petrissage number 2 to the thumbs, but opposite. They will meet. They will meet here. I will shift, you see, and I shift tissue collateral, bilateral. I shift tissue bilateral, and here hand. I shift and deeper and deeper. 1, 2. Okay. Petrissage number 3 we're using on neck. You see, it's allowed us to shift tissue posterior and to expose when we're shifting. On my DVD number 12, where I'm proposing deep tissue mobilization, I'm explaining there 4 strategies for deep tissue mobilization. One of them, shifting tissue, shift superficial tissue in order to expose deeper layers of tissue for stimulation, for massage. The second strategy is to shift tissue. An example right now I will demonstrate in cases of performance muscles syndrome. Mobilization of performance, and performance originate from anterior part of sacrum and insert into greater trochanter area and covered actually by glutes. Here, in order to perform deep tissue massage, we have to shift. You see what I'm doing? I'm shifting, and right now here we're utilizing, because of bigger mass here. But first of all, you see, if I will compress, I will transmit some pressure to the performance muscles. Very little mobilization will be, but the other strategy is to shift the tissue upwards, and here you can see I will put even elbow, and I do recommend to utilize elbow for stimulation. We know the topographically how this performance located, and little by little we will do with elbow mobilization and compression even from this, but this will be due to our capability to shift the superficial to go. This is the other strategy. 1, 2, 1 initial pressure, like here, initial pressure. Here we're squeezing neck between fingers and thumbs, squeezing, and 1, 2. You see a lot of tissue is shifting posteriorly, and if you will see here, a lot of tissue was shifted, and here I have opportunity to stimulate very deep the layers of neck. Petrissage number 3. You saw my demonstration on neck. Just growing and shifting posterior as much as possible. We utilizing Petrissage number 3 on neck, ankle, knee in orthopedic massage, shoulder in orthopedic massage, like this. Just to give you the idea. Yeah, this is here I cover like neck area cover. Here on projection of joint, I squeeze and shifting posterior. I'm mobilizing. Just to using opportunity, I will demonstrate a little bit Petrissage number 3 on knee region. Again, exactly like on neck, we're surrounding, and equally the thumbs and fingers have to shift tissue upwards, and this would 1, 2, 3 allowed us pretty deep mobilization.
Petrissage number 4.
Petrissage number 4 is most powerful kneading in segment reflex massage. We mobilize paravertebral zones. Of course, spinal processes will not massaging, but like this, you create corner. This will be the barrier, and with fingers, you paravertebral zone, you pushing, and a little bit resisting like this and pushing. And you see, it's massive. This corner barrier do not allow to tissue to run away. You see it, and this is massive mobilization. Very powerful mobilization in reflex, segment reflex massage.
Petrissage number 5.
Petrissage number 5, we like Petrissage number 4, but here Petrissage number 4 will be not effective, but on all these other parts to use like this. Elbow will be the instrument, like here fingers to shift, but all other part, not only paravertebral zones, we're utilizing Petrissage number 5 on legs, on thighs, on large people who very difficult to mobilize by finger shifting. We will utilize Petrissage on lower back. When orthopedic massage we're performing on lower back, you have to utilize Petrissage number 5. And this is like this. You're applying initial pressure with this little part. You don't go like this. And again, this corner will play a role, like on Petrissage number 4, will play a role of barrier, and we're shifting with, again, this part. You not go pinpoint this, like 10% of forearm close to the elbow. It's kind of bony structure you can feel. Yeah, and in this manner. 1, 2, you have to, you see this, that's full circle, and the other hand resisting shifting, barrier the shifting of tissue, and very massive mobilization happened right now on thighs, front and back thighs. Very massive mobilization.
Petrissage number 6.
Petrissage number 6 actually will perform almost with this manner, like Petrissage number 5, but instead of forearm we're using kind of fist. You can put fist this manner or from here. You apply initial pressure and you shift, you pushing to this corner barrier the tissue. 1, 2, 3, 4. Petrissage number 6, exactly like Petrissage number 5, number 1 and number 2. We're utilizing on back, can incorporate on back, post-event sport massage. We're using this on back, on the hamstring, on the front thigh, on quadriceps, as well calf muscles. It's pretty massive. It is pretty massive mobilization. Number 5, I wouldn't recommend on calf muscles, but 6, yes. In the same time, Petrissage number 5, you can apply as well 6.
Performing kneading techniques shouldn't be a hard labor. If you feel your wrists, arms, or hands are tired, you are doing something wrong. Continuous kneading awakes relaxation reflex in superficial layers of muscles, which allows you to stimulate deeper layers of muscles. It's not the amount of pressure that you deliver that simulates deep tissues, but a sufficient amount of kneading movements in one place. Petrissage number 7.
On forearm Petrissage number 7, we have to place like this on the elbow part like this. We have to, and again, we're grabbing like this, one hand squeezing, doesn't matter which hand, you can, this will play a role of barrier. I like my right hand, but you can utilize as you wish. You just surrounding, grabbing, and like this. And again, you see, this just additional time I would like you to see very massive kneading, and my left hand in this case, do not allow the tissue to move, just to be shifted, and this creating very massive pushing up and very massive kneading. Bottom line, massive deformation of proprioceptors as well. Fascia muscles aligns mobilization that allowed the muscles to return plus minus to the normal resting tonus as well. Fascia to be released as much as possible. Petrissage number 7. Usually we're utilizing on lower leg, forearm. This is the main utilization. Allow us very massively to stimulate this anatomical structure. You see, the one hand will do grabbing and shifting like I squeeze, like in Petrissage number 3. What we're doing here, one hand will go like this, and other by surrounding like this lower leg will barrier. And you see, this is kind of very short shift the tissue have, and this what allowed us to maximum extent to mobilize muscles as well, fascia also. This is Petrissage number 7. Will perform kneading in a form that as much as possible tissue will be kneaded with other hand. This kind of compressing and stretching soft tissue, and other hand in circle motion. Like another parts, also like around 3 minutes, we massaging the feet and lower part of the leg as well.
Petrissage number 8.
Petrissage number 8, in deep tissue mobilization we're utilizing as well when we performing massage on people who suffering from bronchial asthma, and as well prevent sport massage. We're using number 7 and number 8 kneading techniques. Actually, the contact area is phalanx, is a contact area, and look, thumb in this case just barrier and support. When 2 thumbs like this thing, you see in this case, if you can see this fold of soft tissue, pretty much barrier. And actually what I'm doing here is the barrier, my thumbs, here is the contact, and apply initial pressure, and 1, 2, 3 towards the thumb, and 1, 2. On people with asthma, we have to do this a little bit faster, and at the time of prevent sport massage, around 100 times per minute, it have to be a little bit faster. In deep tissue mobilization, yes, 70, 80 times, like 1, 2, 1, 2, 3, 4, 1, 2, 3. On one place, yeah, and deeper and deeper.
Petrissage number 9.
Petrissage number 9, we're performing exactly like Petrissage number 8, but different hand after hands, like this. 1, 2, 3, 4, and 1, 2, 3, 4, 1, 2, 3. Don't try to utilize wrist, will be wrong here. You see, with muscles of wrist, actually more stabilization and movement is the flexors a little bit. Yeah, and when very short motion, as you can see in such a case. Yeah, just look, shoulders don't raise like this. Yeah, just relax, and you shouldn't feel right now no tension in wrist area. This, you see, I apply this pressure on ankles and on knuckles, and I perform this Petrissage number 9.
Petrissage number 10.
Petrissage number 10, we're performing with, and a lot in post-event sport massage, very important to perform this, very important. You just placing like this with ulnar part, you're placing in 1, 2, 1, 2. You can even close like this a little bit, but I will show you. 1, 2, 1, 2. This kneading techniques proving and special when 1, 2, 3, 4, and after the fast you will move, and proving very effective in management of scar tissue. Therefore, this, yeah, they're all kneading techniques helping, but this it's much more precise, proving to be all kneading techniques is additional to being great stimulator, great techniques that allow us to create a massive action potential, massive impulse. Yeah, this also helping to manage this micro scar tissue. We cannot allow to calcium grow there. And post-event sport massage, yeah, and when you reach deepness, you have to, yeah. This on my DVD number 7. Full set, pre-event, post-event, sport massage as well, stretching on all regions of body. In this inhibitor regime, I create the amount of impulses and quality of impulses that causing little by little decrease of tension, and I will go with ulnar age. As much as possible, we should minimize disconnection from body of our clients. Yeah, 3 hours DVD. This is volume number 7. Also recommend. I recommend all my DVDs. I kind of share my 35 years of experience. I would love you to know this.
Petrissage number 11.
Petrissage number 11. We're utilizing this is not a like we even like this. It's a little bit shifting, and after this you have to create motion forward, back, forward, back, forward, back. You shift, you see, you shift to the different. The one will shift from you, one forearm to you, and when it's in maximum, you just go like this, like this. It's shifting. You don't start movement or like in Petrissage immediately. First of all, you stretch to the tissue to the opposite direction, and after this you start kneading. Shift and kneading, shift and kneading, shift. In post-event sport massage, very important. In deep tissue mobilization, also allowed us to mobilize very deep. shift, kneading, 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 shift, kneading. First of all, you can see camera show you shift, and after this kneading, shift and kneading.
Petrissage number 12.
Petrissage number 12, we have kind of a pretty limited utilization, mostly on calf and forearm. We do, this is two movements. First of all, you have to grab, shifting posteriorly. You see what I do? Shift, 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 shift as much as I can. You see, I shift first of all. You see, with one hand. Now I grow with other, bigger amount, with other. This is kind of preparation. And maximum, I shift upwards tissue. On this condition, after this, you start kneading like Petrissage number 2, 3, something combination between this. And again, you grab, you shift with the other hand, more shift, 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 shift. This is meantime not kneading. When it's maximum, it's already under maximum stretch posterior, you start 1, 2, 1, 2. In post event, very important, ischemically compress. We will hold like this. No effort to stretch a little bit needs. To stretch, like to mobilize this in this kind of position, and after this we will compress. Compress, 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 and drop in one time. And again, little by little, you're grabbing up, 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 you see, in this kind of position. Now we start compressing, 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 compressing for 10 seconds. Hold, 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 and drop. And like this, we 3-4 times on calf muscles, we will repeat compression, 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 and drop. When we're treating peripheral artery diseases, very famous Burger disease, you know, the insufficiency of blood supply. By the way, on my DVD number 9, and in details, I explain this protocol and much more. Very important helps, and of course, post-event rehabilitation in cases of sport-related injuries that involved a little bit tears. Yeah, this is very important rehabilitation. After this, the scar tissue will be formed. This mobilization very, very important. You can do here also Petrissage number 8 and 9, but number 12 allowed us a lot of advantages for perspective, give us advantage from perspective capability to shift massive and to mobilize.